Hey everybody, my name is Dr. Caleb Stott. I am one of the founders of Smile Now Dentures and Implants. Every single month, I am, just like many of you, online, listening to people's experiences with dental implants and reading a lot of the questions that they have about treatments and what it would mean to them. And so what I'm doing right now is I've taken the top questions that I saw and that I saved, and I'm going over those so that you can understand and hear from somebody that does dental implants every single day and has been doing this for years and years and years. What would I say to these questions? What would my response be? And how can dental implants help you? So, anybody know of any sort of grants or anything to help afford dental implants? I'm 24. I don't want to be in dentures for the rest of my life, but I cannot afford $32,000. I work full-time and pay bills, and I'm a full-time college student. I don't know how to make this work. So this is also about affordability. So what I would say is that affordability a lot of the times comes with financing, right? If it was up to me and I was looking for treatment, first of all, I'd say $32,000 is on the low end for this type of treatment nationwide. If somebody is doing it for less than a lot of the costs associated with it, it just makes me wonder why. And I would want to make sure that I had the best possible treatment if I was young, and 24 is extremely young for this, and I was looking for treatment that was going to last me the rest of my life, maybe 60 years. As far as the other question, are there grants or anything to help afford implants? I do not know of any government grants for these types of things. It used to be that health insurance could help out with that, but that's becoming less and less prominent. It's very, very rare for that to happen nowadays. If you are looking for help and you can't quite afford it, sometimes dental schools can help out with this. Treatment's a little bit less, but they don't do this type of work. This type of work is really not designed for dental students and what they're going through. And then sometimes there's some residencies and they do offer it at a discounted price because they are teaching and having people that are students that have never done this before do it on you for the first time. And then usually those don't include things like anesthesia and whatnot. So it's a harder situation. My best advice would be get in a situation where you can afford it. Financing is going to make it possible, and do it with somebody that is trusted, that has a lot of reviews, somebody that's done this before. It's not their first time, because you want this to last your lifetime. You don't want this to be a momentary or a short-term fix, especially at that cost. Did anyone have soft bone and their implants still survived long-term? I'm talking D4 bone. So what D4 bone is there's a different classification of bone in your jaw, and there's areas that are more prominently what I would say D1, D2, D3 bone, and D4 bone. So when we're talking about D4 bone, usually we're talking in the upper arch and then all the way in the back, which is the softest bone in the jaw. Did anyone have this type of soft bone? D4 just means it's softer. D1 is, means it's much stronger. So did anyone have implants placed in their D4 bone and have it survive? Absolutely. So you still have the ability for osteocytes or bone cells to attach to the surface of the titanium in there, especially if you're familiar with remote anchorage, which means that we're placing bone into the pterygoid, which is bone that is where different parts of the skeleton fuse together. Then this is usually D1 quality bone, even though it's around areas that are D4 quality. And this gives you much greater success and the ability to immediate load. What can happen is if people have implants placed in and there's not initial support or initial stability, what can happen is you are put into a denture and have to heal in that for 6 months, and then they'll go back in and do a second surgery, which is like an uncovery surgery, where they expose the implants and then they put on the abutments that are used to put the teeth on afterwards. And that can still work. It takes a lot longer, and by using remote anchorage, you can forego all that healing time and just get to the point where you have your teeth faster, which is the main goal. So another question, just a heads up that you should read carefully about the actual place where implants are manufactured. And not just that, the company is based in Switzerland. I don't know where this question came from, but recently me and my colleagues at Smile Now Dentures and Implants had the opportunity to go to the headquarters of the implant company that we use, and that's called Neodent. So Neodent is part of the Straumann family. When they are referring to Switzerland, there are multiple implant companies that are from Switzerland and made in Switzerland, but there's a lot of different companies that make implants in different places. It is important to know how an implant is manufactured, the quality of the implant, the type of titanium, because these things all affect how well the implant will do after it's placed. I use an implant company in my practice that's been around for decades. It's one that is used all over the world. Their headquarters are in Brazil. So I actually went to Curitiba a couple months ago and took a tour of their warehouse and their manufacturing, and it was was top notch. I could not believe how much effort they put into making the implants, and it really gives you a great appreciation of what goes into somebody's smile, right? So this question to me sounds like somebody had a bad experience with implants, and after they started to look into it, maybe they were uncomfortable with things that they otherwise could have known had they really looked into it. What I would say about dental implants is they've been around for a really long time. There's a lot of companies that have made dental implants over, the 50 to 60 years that they've been around. One thing that's really difficult, especially in my practice, we have a lot of patients that come in and they've had implants for, 10, 15, 20 years. Well, they have all different implants from different companies, and as we go and do our research of who these companies are, because we need to get additional pieces like additional screws, additional abutments that fit into these implants, we find that these implant companies no longer exist, that these parts are no longer made. And so effectively what that means is that these implants are no longer viable to replace your tooth. If we don't have the replacement parts or we can't get to them, then it just makes it really difficult. It's more time consuming, it costs a lot of money. So we use an implant that is nationally recognized as one of the best implants in the world. These implants get made in different locations and then they're transferred. If they're transferred and it gets too hot in the container or something like that, then it can cause damage to the surface treatment of the implant, and then that can cause failures. It's not fun for the provider, it's not fun for the people receiving it. So for me, when I'm looking at an implant company, I'm looking at one that's been around for a long time, has a good track record, doesn't cut any corners. Usually these are the implants that cost more than the alternatives, but in the long term, it's cheaper to do it right and have it be something that you can work with in the future than just getting the upfront savings of going with a cheaper implant, which is how some people offer treatments for a lot less than others. Hopefully that kind of answers it, and I hope that this person really figured out how to get the proper implant that they were looking for, one that makes a lot more sense to them. I hope these questions have been beneficial. I look forward to doing this again next month, and I'll talk to you later.